In a landmark move, the UK Parliament has cleared the Tobacco and Vapes Bill, a law that will ensure anyone born on or after January 1st, 2009 can never legally buy cigarettes. This isn't a typical age restriction like 18 or 21. Instead, it's a rolling ban. The legal age to purchase tobacco will increase every year, effectively locking the future generations out of smoking for life. The goal is simple but ambitious: to create what policymakers are calling a smoke free generation. Hello and welcome to The Print. I am Samah Qundeel and let's see what this new law says. Under the new law, a person born in 2009 will never reach the legal age to buy tobacco. Not at 18, not at 30, not ever. Meanwhile, those already legally allowed to smoke won't be affected. Over time, this creates a gradual phase out rather than an abrupt ban. This is a major shift in how governments approach smoking, from trying to get people to quit to ensuring they never start in the first place. And the reasoning behind this is rooted in data. Smoking remains one of the leading causes of preventable death globally. It is strongly linked to lung cancer, heart disease, stroke, and chronic respiratory illnesses. Most smokers begin young, typically before the age of 21, which makes early prevention critical. Recent data from surveys published in the British Medical Journal shows why the UK is acting now. The Smoke-Free Great Britain Youth Survey found that smoking among 11 to 17-year-olds rose from 3% in 2021 to 4.8% in 2022, and further to 5.4% in 2025. Even more striking, the number of young people who had ever tried smoking jumped from 13% in 2021 to 21% in 2025, the highest recorded in 13 years. At the same time, vaping is rising sharply. Current vaping among young people more than doubled from 3.2% in 2021 to 7.2% in 2025. These parallel trends, rising smoking and rising vaping, have raised alarm bells for public health experts, which is why the law doesn't just target cigarettes. It also gives the government sweeping powers to regulate vaping and nicotine products. New rules will ban vaping in cars carrying children, as well as in playgrounds, outside schools, and near hospitals, expanding the UK's smoke-free zones. However, vaping will still be allowed outside hospitals, partly to support people trying to quit smoking. And importantly, these restrictions won't apply to private spaces. People can still smoke or vape in their homes. Outdoor venues like pub gardens and beaches are also not covered under the ban. The larger idea here is harm reduction without overreach. Supporters of the law say long-term health impact could be transformative. Fewer smokers would mean lower cancer rates, reduced pressure on the National Health Service, improved life expectancy, and cleaner public spaces. UK Health Secretary Wes Streeting has called it a historic moment, saying the reform will save lives and ease pressure on the healthcare system. Health Minister Baroness Merran described it as the biggest public health intervention in a generation. But the policy isn't without criticism. Some argue it restricts personal freedom, essentially deciding for future adults what they can and cannot consume. Others warn it would lead to black market sales or create enforcement challenges for retailers who will now have to track eligibility based on birth year, not just age. There are also concerns about whether vaping could become a loophole, especially if young people shift from cigarettes to e-cigarettes instead. Even so, the UK is pushing ahead with a clear long-term vision. This isn't just a law, it's a generational strategy. By ensuring that those born after 2008 can never legally smoke, the UK is trying to cut nicotine addiction off at its source. And if it works, it could set a global precedent, changing how countries tackle one of the world's deadliest habits, not by managing it, but by phasing it out entirely. Thank you for watching. For more such content, keep watching The Print.